children in the U.S. are living with peanut allergies than ever before. It's a condition that can impact every aspect of a child's life and be extremely difficult for families to navigate. Joining us this morning to discuss are pediatric allergist Dr. Douglas Mack and Sarah Koreishi, the mother of a child with a peanut allergy. Good morning to you both. Thank you so much for coming on this show. This is a very important conversation, so we're very appreciative of your time. Dr. Mack, I want to start with you. Tell us a little more about what it means to have a peanut allergy and how significant this is, not only for the child, but the entire family.
Yeah, peanut allergy is a significant issue. You're right, not just for the child, but for the family and even for the broader community. We've never seen so many patients in North America have a peanut allergy. And I think one of the challenges is that, yes, about 20% of these kids may outgrow this, but the other 80% of these kids will continue to go on to have a lifelong peanut allergy that can cause mild, moderate, or even severe reactions. And I think with this growing increase in prevalence and even severity, there's an ongoing need for an effective treatment option. You know, when I first started doing this, our only options were simply to tell families, hey, avoid peanut, and here's your epinephrine auto-injector, and do your best. I think for many families and for many clinicians like myself, avoidance is simply not enough. The chances of accidental reactions are high, and unfortunately, reactions do happen despite all the best efforts of the family. I think the good news is that there's a lot of research that is currently being done within the allergy sphere, and some promising innovation I think will change how we deal with these peanut allergic kids moving forward.
Yeah, but certainly very concerning for children who do have this known allergy. Sarah, I want to ask you, as a mother, you know, what is it like? Give us that sort of perspective on that concern that's 24/7, 365 days a year.
Yeah, I mean, that's exactly what motherhood is, and the food allergy just adds a whole new layer of worry and anxiety in terms of just thinking about how my daughter navigates life where food is always going to be present, and making sure that she doesn't accidentally eat something that can make her really sick is something that's on my mind constantly.
So talk to us about how you're currently navigating this allergy. You know, you talk about that concern if you're not around, what she can do, how quickly she can react. Talk to us about what treatment is like right now for you.
Well, right now, she carries EpiPens. I mean, we have them at her school. I carry EpiPens with me all the time, as does her dad. It's a lot of conversation that we have to have with family members about foods that we've had traditionally in our families for generations, how to modify things, or how to make space for her to bring something else and still be a part of events. Birthday parties, Halloween, Easter, fun things for kids, making sure she can be a part of it, but being very mindful that she has access to foods that are safe for her.
Dr. Mack, looking forward, any new treatment on the horizon? Anything exciting?
Yeah, I mean, I'm an investigator for a ongoing phase 3 clinical trial called VITESSE, and it's looking at an investigational skin patch called VIASKIN Peanut. It's for children ages 4 to 7 who have confirmed peanut allergy. And what's really, I think, amazing about this approach, about this patch, is that it's a tiny amount of peanut protein that is applied directly onto the back, about 1/1000th of a peanut. So these kids are not eating any of this peanut. It goes directly on the back. And this ongoing exposure to peanut through the skin, what it does is it stimulates special immune cells that are present in the skin, and what that does is help to retrain the immune system. This leads to what we call desensitization, which refers to the ability to eat more and more peanut protein before experiencing an allergic reaction. And it makes it less likely that a child will have a reaction after an accidental exposure. So these kids are still going to avoid peanut. They're still going to carry their epinephrine, but I consider this like a buffer of protection, almost like wearing a seatbelt. It can reduce the likelihood of an accidental reaction and can potentially be life-saving for children who are accidentally exposed to peanut, despite the best efforts of the family. So it's really something I think exciting, and that's something that families should check out.
Yeah. Okay. All good information. Dr. Mack and Sarah, thank you both for your time this morning. We appreciate it.